The NHS, the National Health Service in the UK, seems to be in big trouble and is now turning to India for solutions. The NHS is UK's publicly funded healthcare system, and the entire population of UK is covered by the NHS, and the majority of health services there are absolutely free. In fact, NHS can be described as the closest thing Britain actually has to the national religion of sorts. It's cherished deeply. Its levels of public support higher than that of the royal family as well, and of many other British institutions. NHS remains the biggest source of national pride for its people and for the country, but it now stands at a critical juncture, facing challenges that require urgent attention. NHS was established post the World War II, and recently the UK Prime Minister there, Rishi Sunak, whose parents were also NHS doctors and pharmacists, paid a tribute to the NHS and outlined a 15-year plan aimed at recruiting hundreds and thousands of new health staff. Why? Because it is recognizing that NHS is under unprecedented strain following the pandemic. Even though the government has spent nearly 12% of its budget only on healthcare, it's a single, and its single biggest item on the budget. Now, demoralized doctors, nurses have been striking for better pay at aging, and unfit population also needs ever more complex treatments. Cancers go undiagnosed and lack of scanners in hospitals, all of these leading to a situation that is crumbling, a crumbling healthcare infrastructure for UK. Now, Rishi Sunak, the leader there, now turning to India for solutions. It is now looking at hiring 2,000 doctors from India to prevent their medical system from completely collapsing. So we found out what exactly is this. Himani has the details. Himani.
That's right, Sonal. NHS is in crisis and needs India's help. NHS is looking to hire about 2,000 doctors from India to prevent their medical system from collapsing. These Indian doctors will be given 6 to 12 months of training, and then they will start working at hospitals in Britain. These doctors won't have to take the Professional and Linguistic Assessments Board, or PLAB. That's the exam after they finish the training. This exam is otherwise mandatory for starting clinical practice in the UK. However, these placements do not offer permanent settlement facilities in the UK. For many years, the NHS has struggled to address its staff shortage due to various reasons. The UK has been depending on doctors trained in other countries for many years now. This is not the first time. In fact, in 2019, it had one of the lowest numbers of doctors per capita in Europe. But now the problem has worsened significantly. According to global media, the NHS desperately needs more homegrown doctors, nurses, general physicians and dentists to prevent the crisis that could leave the NHS short of 5,71,000 staffers, which are all healthcare professionals. Mind it, this isn't about shortages elsewhere. It's about the severe shortage hitting the healthcare sector. And if they don't fix this, the NHS might not be able to keep up with all the people needing care in their country, especially with the increasing demand due to the growing and aging population. While NHS is scouting for well-trained and experienced doctors from India, the question is, will India help? The IMA, or the Indian Medical Association, which is the largest group representing doctors in India, is not very interested in helping UK. The reason is simple. They want NHS or any other organization to come to India to absorb young MBBS graduate doctors who are looking for jobs, and not those who are already settled here and serving the Indian population. IMA has declined to participate in this initiative, and in fact, IMA's national president, Dr. R.V. Asokan, told News18 that they do not want to support the migration of skilled doctors as it could undermine the Indian healthcare system. The message is crisp and clear. Why allow Indian doctors to leave and serve in other countries when their own nation needs them? IMA has politely declined NHS offer to join their initiative as they do not want to become part of this brain drain. Back to you.
That's right, Imani. So obviously Indian doctors concerned that a lot of our professionally trained doctors are going to, leave the country and go to the UK. But isn't there another interesting statistic here where India also in the next 10 years is going to have several unemployed doctors? We have around 706 medical colleges. So how exactly is IMA sort of answering that?
That's right, Sonal. India will have more than 1 million or 10 lakh doctors unemployed in the next 10 years. In fact, the government has announced more medical colleges which will further increase this problem, and more fresh doctors will come from these medical colleges. To solve this issue, IMA has started an employment exchange initiative at the national level, even at the international level, for young graduates, and hence IMA wanted NHS to absorb these fresh graduates instead of well-trained doctors.
I see. So the question is that also how will this really be applicable? Because Himani, what IMA decides might not be mandatory on doctors, right? There might be some doctors who might still decide to go.
On their individual will. If they want to go, they can go. But IMA itself is not promoting. If doctors want to apply for this, they can.
I see. Interesting. Interesting point there. Interesting point there. Thanks, Imani, so much for joining us with the very latest.
Thank you.
All right, on that note, it's an interesting, fascinating story how UK is struggling for doctors. They don't know how to train doctors. They're looking to India for solution. India is saying, yes, we have doctors, but we don't want to give you our very experienced doctors. We'll give you the ones who are fresh out of college and then you train them in UK. Let's see where this story actually goes.